WION is the only Indian network that has been reporting on the outbreak from day one. There is panic in India after more cases have emerged. What are the symptoms of the disease? What should someone do if they are sick? Like we have been saying, prevention is better than panic. And we at WION have compiled a list of the frequently asked questions and their answers, information that you can use in the fight against the disease. Question number 1, what are the symptoms? Those who have been infected suffer coughs, fever and breathing difficulties. The symptoms could take up to 14 days to appear. The coronavirus can cause pneumonia. Runny nose, which is typical of a cold, has not been reported as one of the obvious symptoms. Question number 2, what can you do if you feel sick? The WHO recommends turning to your local hospitals for the right advice. Indian citizens can take some additional measures as well. The government of India has set up a 24/7 helpline number and email ID. We are running that information at the bottom of your screens. If you or anyone around you seems to be showing symptoms and have traveled to areas affected by the disease, inform the government helpline. Stay indoors and avoid public places. Question number 3, how deadly is the disease? Diseases like the Wuhan virus, SARS and MERS belong to the same family. They are all coronaviruses. The Wuhan coronavirus is deadlier than the seasonal flu, but not as deadly as SARS. The global rate of mortality is around 3.4%. SARS killed about 10% of the infected individuals. MERS was worst. It had a fatality rate of about 35%. So the Wuhan coronavirus is not as fatal, but it travels fast. The most commonly asked question, do face masks help? While they do not guarantee total protection, experts do recommend using one. The virus transmits through droplets when someone sneezes. If you are close to someone who has been infected, the mask can stop the disease from being passed on. And if you are showing the symptoms, wearing a mask can protect those around you. Question number 5, is there a cure? So far, there is none. There is no approved drug for the disease, but several are being tested. Reportedly, a vaccine is under development as well, but that could take 18 months to hit the markets. So how exactly are doctors then treating the patients? According to reports from last month, the doctors are using a combination of drugs and methods to treat those infected. Reportedly, more than 50,000 patients infected around the world have now recovered. And finally, we would list out for you some precautions. How can you protect yourself? Wash your hands first with clean water and soap. Meticulous hand washing is the best available option. And if that is not possible, one may use wipes or hand sanitizers. Cover your mouth and nose when you cough or sneeze. Basic hygiene. Seek medical help if you have fever, cough, or if you feel difficulty while breathing. Share your travel history with your doctor during the checkup. If you are visiting any affected areas, avoid direct unprotected contact with live animals or surfaces that were under contact with animals. Avoid eating raw, undercooked animal products. That does not mean that you need to avoid non-vegetarian food altogether. As long as one is eating properly cooked food and the food items are properly cleaned, they should be safe to consume.
Hand washing in general is a very good practice. Staying at home if you have a cough and cold, making sure that when you're coughing that you have your nose and mouth covered, and wear a mask if you have to go out. But again, wear a mask only if you have a cough and cold, or if you're a care provider for somebody who is sick. It really doesn't help for the entire public to go around wearing masks. It's only going to lead to shortages for those who need them.